I'm Caesar. I'm the owner of Sketchbook. I'm also on the board of directors with Ivy of Replace Plastics. Yes. Welcome to Replace Plastics, first event. And we're here to bring awareness to the health effects of plastic. We are working with local retailers to try to replace plastic as much as possible, starting with plastic bags. You see there's a little bag swap in there. Feel free to grab one of the Sketchbook branded bags. It's free for you to take home if you don't have enough of them at home. I want to thank our sponsors, Organizing for Plastic Alternatives, Go Green Kenilworth, Skokie Chamber of Commerce and Industry, Rotary Club of Skokie Valley, Go Green Skokie, League of Women Voters of Evanston, and Coalition for Plastic Reduction for making this event possible. And I would like to introduce Ivy Sundell, the founder of Replace Plastic now.
Well, thank you everybody who is joining us in person or on Zoom. I want to give you an overview of the program. We will have a speaker present his findings on the health effects from plastic, followed by tips about ways to reduce plastic in your daily life. If you're a retail business looking to reduce plastic bags in your store, stay tuned and we will tell you our alternatives and how we will work with you to make the transition smooth and also at minimal cost to you. We will have a Q&A in the last 20 minutes. It is a great honor to introduce two extraordinary leaders in the field and professor, physician, and scientist from the University of Illinois College of Medicine. Dr. Robert Sargis is the associate professor of endocrinology, diabetes, and metabolism. His research focuses on hormone disrupting chemicals and how it can contribute to obesity and diabetes. He treats diabetes and lipid disorders that lead to cardiovascular diseases in his clinical practice. He will be the one presenting his findings on the health effects from plastic. And then he will be joined by Dr. Gail Prince for the Q&A. Dr. Gail Prince is the Michael Reese Professor of Urology, Physiology, and Biophysics and Pathology. She is also the co-director of Chicago Center for Health and Environment. She's also the director of UIC Andrology Lab, which diagnoses and treats infertile couples and provides sperm bank services to patients nationwide. Her research focuses on prostate gland development, prostate stem cells, and how normal cells turn into cancer by hormones, hormone disrupting chemicals, and a fetal basis for adult prostate disease. So we have some really high-powered people, and we're so fortunate to have Robert to present your findings next.
Thanks so much, Ivy. I really appreciate it. I'm super excited to do this with Dr. Prinz, who, as Ivy mentioned, is the director of our amazing environmental health center, which I will share with you a little bit about at the end in case anybody is interested. So my name is Rob Sargis. I'm a clinical endocrinologist and I have a research lab focused on endocrine disrupting chemicals, some of which are found in plastics, which is one of the reasons I'm here to chat with y'all today. So just by way of disclosures, I do some consulting, speaking, also do a little bit of community engagement work. And it's been amazing talking to everyone before this presentation to hear about your engagement in the community, because it is coming at a time that is absolutely critical. If we are going to do anything to make this world better and to make our environment healthier, we are going to do it together. And it's really exciting to see y'all coming together to really make a big difference in your communities and then across communities in Chicago. My scientific mission is really to understand how humans alter the environment and how those alterations impact human health. And I'm a physician scientist, so I care for patients. I was in the clinic this morning. So an important focus of what I do is to really try to understand how we can translate knowledge of environmental exposures into action in order to improve human health. So we're here to talk about plastics today, and I think that these pictures basically sum up how many people think about plastics. We think about this as a macro problem of plastic pollution that's contaminating our oceans, our land, basically everywhere we look, we see an environment that's contaminated with plastics. But what I want to emphasize to everybody today is what we're really talking about is a diverse family of different risk factors. So those macroplastics that we consider are just one part of this. So these plastics that we incorporate into every aspect of our lives get broken down into these micro and nanoplastics that are increasingly recognized as having potentially adverse health effects. We'll talk about that a little bit as I go through. And what's also important is that these plastics are not just a problem because they're plastics, but these plastics are also vehicles of exposure to chemicals that are in those plastics that are non-covalently bound that can alter things like hormone signaling, cancer risk, and all sorts of different adverse health effects. So when we're thinking about plastics, what we're really thinking about is a problem that extends from those plastic bags to their breakdown products, to the chemicals that they're leaching into the environment and into our bodies. So one of the things that sort of drives me is this idea that we have many people in this country who are suffering from ill health. And the question that we face as clinicians is, how are we going to best protect the health of our loved ones, our patients, our family members, our communities? And every time I think about this, I think about Fannie Lou Hamer, who, if you don't know, was a civil voting and women's rights activist who gave this famous speech 60 years ago this week, famously entitled, in which she said, "I am sick and tired of being sick and tired." And I think that that ethos is something that we should all be thinking about, and because we all should be sick and tired of the suffering that we witness amongst our friends, our family, and our community. And as such, we need to step up to address those drivers of adverse health that have been neglected for many years. So to talk about plastics, we could talk about any number of different things, right? Like this could be a topic that goes on for weeks or months, right? So I'm going to focus on one particular disease that I think illustrates the issue of plastics. And it's a disease that's near and dear to my heart because it's what affects most of the patients I see, and that's diabetes. And I'm going to make the argument that diabetes is actually a disease that's amplified by plastics. So we're all on the same page. Diabetes is a disease that afflicts somewhere around 537 million people globally, with 783 million people projected to have the disease by the year 2045. It is not just a disorder that affects folks in the United States and Western Europe. The highest increases in diabetes rates are in places like Southeast Asia, the Middle East and North Africa, and Sub-Saharan Africa. And what's important about diabetes is while we think about it because it raises blood sugars, it's important to recognize that this disease is the leading cause of adult blindness, kidney failure, non-traumatic amputations, and a potent driver of cardiovascular disease, which is what kills most people. And its economic impact is staggering. So other than sort of just the human toll, the economic impact is estimated to be about $413 billion in the United States alone, and it's projected to be over $1 trillion globally by the year 2045. So this is a disease that has immense individual and community and, in fact, global impact. So what's the connection with plastic? So this is a slide that we put together back in 2011. So this is going to illustrate two basic things. So what you see here in red is diabetes rates in the United States from 1958 to 2008. And what you can see is this exponential increase in diabetes rates in the United States, right? What I'm showing in blue is synthetic chemical production in the United States from 1938 to 2008. And there's this little blip downward here in 2008 that is not a reduction in manufacturing that's real. That's just the economic downturn from the recession in 2008. And what you can appreciate from these two curves is how they move together, that the rise in diabetes rates is occurring at the same time that synthetic chemical production is increasing in the United States. Now this is not evidence of causation, right? But it's really interesting to think whether these two things are potentially linked together. And many of those synthetic chemicals are used in plastics or the production of plastics. So the question has become over time, is it possible that these two phenomenon linked in time are actually mechanistically linked, that they are associated by scientific evidence that the chemicals that we're putting into our environment are actually contributing to the development of diabetes? So what are these chemicals? So these chemicals are sort of these amazing inventions that have happened since the 1930s. So these include chemicals that are used in food production, so including agricultural pesticides, things like pesticides, food additives, packaging materials. There are chemicals that are generated through industrial activity. They're the chemicals that we choose to use, the chemicals we put on our bodies and use in our homes in personal and home care products. And in a separate thing that we can talk about on the side, they're chemicals that are actually used in medical care as well. But what's important is across all of these classes, many of these chemicals are actually used in plastics. And these include chemicals like bisphenols, phthalates, these perfluoral alkyl substances that are getting a ton of attention. They include things like flame retardants and other chemicals as well. So what we're talking about is a diverse array of chemicals used in a variety of products that could potentially be linked to adverse health effects. And so we're on the same page. This is a slide that I use with students all the time. What is diabetes? So diabetes is an elevation in blood glucose levels that causes myriad problems with health. Normally, blood sugars are kept in a very tight range through the action of insulin. And so the way that this is represented in this graph is if you start at position A and you suddenly start to find religion, you start exercising, you're taking care of yourself, you're sleeping better, you become more insulin sensitive, your body makes less insulin, and you stay in the same tight blood sugar control. That means your blood sugars are normal. The problem is that most of society is going in the opposite direction. We're sleeping less, we're more stressed, we're gaining more weight, we're less physically active. And what happens is we become progressively more insulin resistant. We move up from point A to point C, and our body's got to fight to keep those blood sugars under control. And the problem is the longer that fight goes on, the more those cells start to fail, and the more you start to deteriorate and your blood sugars start going up. You first sort of enter into this phase of impaired glucose tolerance, in which your blood sugars are high after you eat. And then you ultimately develop what's known as frank type 2 diabetes, in which your blood sugars are high basically all the time. So that's how diabetes develops. So what does this have to do with pollution in any way? Why am I even talking about this? Well, the evidence suggests that, and this is evidence from cells, animals, human studies, even clinical trials, have shown that the chemicals that we're exposed to can make the insulin in our body work less well, can drive insulin resistance, and can also impair our ability to make enough insulin to keep our blood sugars under tight control. So what you have are chemicals that hit both of these sides that lead to this deterioration in health and potentiate the development of diabetes. And you may say, well, I'm only exposed to one thing here. Like, does that really matter? But the fact of the matter is each of us has somewhere between 2,000 and 3,000 different chemicals in our body. And you can imagine that a few on this panel and a few on this panel adds up to death by 1,000 cuts. And when you add that to physical inactivity, you add that to weight gain, what you have is a recipe for these environmental drivers to to force the development of the disease and potentiate the development of diabetes. So, and this is evidence that's been accruing over the course of the last 20 years. And as I said, robust evidence from cells all the way to humans pointing at these connections. And so the other question then becomes, well, okay, like fine. So these chemicals may potentiate the development of diabetes, but what's the magnitude of this effect? Like, is this really impactful when we think about all the other things that might be leading to the development of diabetes? And I would argue that it is. So the best scientific evidence that we have when we look at population studies in humans are meta-analyses. Meta-analyses that put together a bunch of different studies and basically ask the question, if you're exposed to high levels of chemical A versus low levels of chemical A, what is the risk of diabetes? And what these analyses have shown is that those who are most highly exposed to bisphenol A have a 28% higher risk of developing diabetes. That's pretty significant. Those with the highest levels of phthalate exposures have a twofold higher risk of developing diabetes. And this goes on and on for each of these chemicals. And what's important is that these same chemicals aren't just linked to diabetes, but they're linked to other metabolic disorders like obesity, fatty liver disease, and others, as well as other conditions. And what's important also to remember about this data is that this data is looking at single chemicals or small families of chemicals. It's not taking into account the reality of how we are exposed to these chemicals, which is as mixtures. So if each of these contributes that same type of effect, what you see is a gross magnification of the risk imposed by exposure to these chemicals that are found in plastics. The other thing that is important to recognize is that we're not all equally vulnerable to these chemicals, and there are certain windows of exposure in which people are particularly sensitive. And so this was a patient called me a couple of months ago and basically said, Doc, so this is a patient that I see at the VA. He said, Doc, I know I've been exposed. So he was exposed to Agent Orange during his service during Vietnam. He said, I know I've been exposed, but I want to know what this means to my kids and what this means to my grandkids. And the reason that this is important is that the scientific evidence suggests that when we're exposed to these chemicals in plastic during early periods of life, during in utero life, when we're in the womb, or shortly after birth, that those adverse effects are multiplied. That you can have those exposures occurring early in life that increase your risk of developing a disease later in adulthood, even if that exposure stops. So when we talk about what we're doing with plastics, we're not just affecting individuals, but we're affecting generations. And those generations may experience reverberations of these diseases that go on for generations through through different forms of inheritance. So the other thing that sort of sticks in my craw about this quite a bit is that diabetes is a disease of injustice. So we have known for a very long time that Black, Hispanic, Indigenous, and low-income communities experience higher rates of diabetes than other communities. The other thing is we have known that for a long time, and we still have done very little to address those disparities. Some of those are actually still increasing. So my lab has done a little bit of work to say, well, is it possible that these high rates of diabetes in these vulnerable communities are amplified by higher exposures to these chemicals? And I would say this, these communities not only have higher rates of disease, but they also are more likely to develop the consequences of that disease. If you're Black in America, you are 2 times more likely to die from diabetes than if you're a non-Hispanic. So the question my lab has asked is whether this could potentially be related to exposures to chemicals and plastics, and the answer is potentially yes. So we've done a number of different analyses to show that low-income communities of color have higher levels of exposure to these chemicals. These aren't the only communities that are exposed, but these are some of the communities that experience the highest rates of exposure. So when we think about disease disparities, this is something that has long been neglected and needs to be addressed. Okay. So why do we care? So we care, I think, not only because it's a justice issue, but we care because it affects other aspects of this disease. So as I said, I'm a clinician who cares for people with diabetes. So we've got these fancy algorithms for how we should treat people with diabetes. You know, we look at what their diseases are, we get them on certain medications, and we treat them. But as I told you, this industry is a $400 billion cost to the US economy, right? These drugs are expensive, and all of these efforts that we're doing are not addressing the fact that the disease is increasing in prevalence, right? We have an increasing burden of a disease that is increasingly expensive and causing significant morbidity and mortality. So the question is, could there be a better way? And what I would argue is when we look at plastics and the adverse effects imposed on our health by plastics, that includes not just diabetes, but disorders like obesity, thyroid disease, fatty liver disease, cardiovascular disease, neuropsychiatric disorders, cancer, and infertility. The better question is, why not reduce the risk of all of these by reducing our exposure to these chemicals overall? This has the potential of having myriad benefits to health that extend beyond just one disease, but can help across various aspects of medicine. So people, I think, are starting to ask that question. And honestly, I think that's why we're here tonight, right? Like because we're asking this question is why we're here. And part of the reason that y'all are interested in this and more people are interested in this is people are finally starting to hear about this. And so this is becoming a big deal because we're seeing stories appear in the popular press. So there's an article in The Guardian about microplastics found in every human testicle that was studied. We're finding chemicals from food packaging leaching into food on NPR. You got articles in People magazine talking about plastics from bags and bottles found in every human placenta. And even in like more esoteric areas like the Atlantic, talking about the risks of microplastics. So where we are as a society is we are at a point in which there's increasing awareness of these health concerns, which again has brought us together today. But what's important is that while we have these concerns, I think it's important to recognize that doctors don't know about this and aren't addressing this, in part because patients are just now starting to ask these questions. Medicine is not at the forefront of environmental health, and we have to push the healthcare system in a direction to make this a priority. This is just one study that came out that I think starts to do that. So this was a study that was published this year in the New England Journal of Medicine that looked at the carotid plaques in people with atherosclerosis. And I want to just show you this slide. This is actually just a picture of those plastics in those atherosclerotic plaques. And what I just want to show you over here is that what they did in this study is they compared individuals who had plastic in their plaques versus who didn't have plastics in their plaques. And what they found is those people who had plastics had a 4.5 times higher risk of having a major adverse cardiovascular event. That's a heart attack, that's a stroke, that's a hospitalization for heart disease. So these are even in individuals who have cardiovascular disease, if you got plastics, the risk of a complication of that disease is greater. And we'll need to see replication of this study. This is the first one. But the great thing about this was in the New England Journal of Medicine, which is the preeminent medicine journal. So we're starting to get more attention amongst physicians, which I think will hopefully help. So what are we going to do for clinical action? So this is something that Ivy, I think, will talk a little bit about also. We did this analysis in which we basically asked the question, when you look at clinical practice guidelines, how do those clinical practice guidelines that physicians use as the Bible for how to take care of people, how do they address environmental health? Environmental health generally, not just plastic. And the answer is they do not. So this gets at this entire issue of this is not a field that is at the forefront of medicine right now. We have to push this issue in order to get medical field's attention on it. We've written about this a little bit. I would direct you at this paper that we published in Frontiers in Endocrinology in 2019 called Interventions to Address Environmental Metabolism Disrupting Chemicals. It is available free on the internet. You can take a look at it. It has advice that we were proposing to give to patients for what you can do to reduce your exposure to endocrine disrupting chemicals in general, not just those in plastics, but those encountered throughout daily life. And then we did something similar in this other paper that I just published this year. So what we're talking about in both of these papers is ways to reduce and eliminate exposures, ways that we may be able to modify the foods and nutrients that we take in to reduce the risk of those exposures, other actions that might be helpful for reducing the impacts of these endocrine disrupting chemicals. And then the other aspect of this is that some of these chemicals that are in plastics that we're exposed to stick around for a really long time. So these persistent chemicals stay in our body despite the fact that we close exposure or end exposure. So there are some tricks that we propose in the paper that may be helpful for reducing the body burden of some of those chemicals as well, that include things like high fiber diets and other things that might be able to interfere with how these chemicals are actually used or reused. The important thing I kind of want to emphasize is that y'all are a great crew because you have been activated and are interested in these issues, and you're here to do something about it tonight. The reality on the ground in my clinic is that we don't always have the resources to do the individual action. And that's because oftentimes these actions are expensive and patients don't have the financial means to do the things that they could do to help themselves. And that's why it's really important to kind of recognize that while we need to take these actions, we need to recognize that there is a tsunami of plastic pollution that threatens to inundate all of us. And the only solution for this is going to be public policy and action on a larger scale. That's how we're going to improve public health. You can improve your individual health, but how are we going to protect the population? So we're going to work together to improve policy. And so this is really the most efficient way to affect a just approach for addressing the health effects of plastics and other endocrine disruptors. And it's important to recognize that these exposures span geographic barriers. So what we really need is a solution that is global in its scope. And so for this reason, this global plastics treaty that's currently being negotiated is immensely important. So this was proposed through a resolution in March of 2022 by the United Nations to develop a legally binding international instrument on plastic pollution. They have met several times. And unfortunately, the most recent the negotiating session concluded this a couple weeks ago without an agreement. We need to push our politicians to move this forward. We need to push our local folks to push the people they report to try to do something to get this moving forward. Because in the end, it has to be about this. The other thing I want to emphasize about this plastics treaty is that the plastics industry wants this treaty to be about plastic waste. And what I hope that you'll get from today is that plastics are not just an issue of waste, but they're an issue of human health. And it's the health component that has to be in this treaty in order for it to make a difference across the population. The fact that this treaty has not been pushed forward is a problem. This is a study I just want to spend a minute on that was published by the Center for Countering Digital Hate. And it's about climate change, but I think it illustrates a really important point about environmental health. So what these folks at the Center for Countering Digital Hate did is they basically analyzed YouTube videos for evidence of climate change denial over time. And what they found was that when you look back in the day, it was all that climate change wasn't happening and humans aren't responsible. But when they look at the new denialism, what is happening now is that these videos are basically saying that climate solutions don't work. You can't do anything about it anyway, so don't worry about it. So their goal is to deny climate change by saying that we don't have any efficacy to do anything about it. And that's why this treaty matters, because we need to show that the things we do matter, because otherwise we're going to fall into this trap of, well, we can't do anything about it. We'll throw our hands up and then just be subject to all the adverse effects that come from it. So I think it's just important to mention this because I do think it illustrates the need for action to do something about plastics. I want to close. I know this can be like doom and gloom, but what I really want to emphasize is that unlike genetics, environments are modifiable. We can do something about this. We can choose a better path forward. We just have to do it together. And so that's what I want to close with. I hope this has been, hopefully it hasn't been too depressing, which is what I always worry about. I also just want to mention that we at the University of Illinois Chicago have an environmental health center that puts on talks that you'd all be welcome to attend. You should check out our website. Our center is CACHE. It's the Chicago Center for Health and Environment. Gail runs it. It's joint between the University of Illinois Chicago and the University of Chicago. Frankly, we're a bigger and more important part of that, but it's a great resource for the community, and would welcome any and all of your engagement with it. So with that, I'll close and be happy to either take questions now or we could do it.
We're going to be talking about what we could do about all this and why would we want to do that. We have been conditioned to think of the good qualities of plastic, that it's lightweight, it's cheap, clear, it's flexible, it's waterproof, it's grease resistant, and not any of the bad qualities, which is that it is toxic. And it's toxic because all the chemicals that makes all these good qualities that needs to be in there because we want all these good qualities is toxic. So I'm going to share some of the things I've done to reduce plastic in my life. I've only found out about the effects of plastic on health about a year ago. And I've done a few things. Some are pretty obvious to people, like switching to cotton bags. So we now use cotton bags to go shopping. Produce bags I've never used, but I know that people use these mesh bags. A lot of times in the grocery store, they either have plastic bags or they have these compostable bags that people bring home. And I don't know if you realize that compostable bags are often only compostable in a commercially compost facility, not anywhere else. So it is like, unless you put it in the commercially compost facility, it is not going to compost. Ironically, I switched my trash bags to compostable bags because the only other alternatives I have is plastic bags or recycled plastic bags. And as my student would say, still plastic about the recycled bags. It's still plastic. So I switched to that, even though I know it's ironic because I'm putting plastic food wraps and dirt and stuff into these compostable bags. And where is it going? It's going to the landfill. So, but I feel like of all the alternatives I have, that's what I'm doing. A lot of food, I'm switching over to glass bottles, olive oil, spices, peanut butter, which is often only available in plastic, honey, which instead of your cute plastic honey bear, I'm now getting a glass bottle. I also buy produce from stores without the plastic wrap because there are lots of stores that would wrap their spinach, their broccoli, the whatever in plastic. And I prefer to shop at places which doesn't do that. Apples, pears, a lot of times they put it in plastic bags and I would just say, okay, that's not the store I would go to. We discovered that mushrooms save a whole lot better if it's put into a paper bag. So we've been putting them in paper bags when we get it home. And it turns out that, how there's the plastic and you put it in the refrigerator, there's some moisture underneath that helps the mushroom rot faster. And without that, it stays a few days longer. So that's a good change. We are using glass containers for all our leftovers. And if it's a bigger bowl or if it's a pie or something, we use beeswax wraps. Put it over the whole top so then we don't have to use plastic. Like some are available in large pieces and you can cut it down to whatever size you want. I'm sure a lot of you are already doing that. There's stainless steel water bottles. You just have to remember to bring it to places so you don't get stuck with it without anything. You need to get a plastic one. So we have changed back to bar soap and shampoo bars. I don't know if anybody uses them, but I discovered them and it's pretty good. Laundry powder. We have gone from powder to liquid to sheets, which turns out to have plastic in them, to tablets. Now I'm back to powder, except that I found this company from the west side of Chicago, a woman-owned company that I normally don't advertise for, but Meliora, and they put the powder in a paper that is steel, and they use stainless steel, so no plastic. And when they send it to you, it's just a paper. There's no paper bag around. It is just it. I know there are lots of refill stations popping up, and I noticed that some of the refill stations have their soaps, shampoos, stuff in plastic containers. But I also found a couple that have glass containers. I have switched to, as you can imagine, a lot of cotton, linen, silk, wool, non-synthetic kind of material. Same with bedding. We have switched to Swedish dishcloth for Viking counters, and I found a plant-based sponge that I've been using, and it is so much better than those old plastic ones because they don't gum up like the other ones. They last a whole lot longer. You wash it in water and all the stains come out. And it's not like icky, after a couple of days. Shower curtains. It turns out that in Europe, they don't use shower curtain liners. They don't use those plastic ones that get old and mildew and then we can't wash them out. Well, guess what? You don't need them. It turns out that if you just use linen or something, it doesn't spray outside the area. And I've been using those and it works really well. You just have to shake it a little and put it outside the cup and it's clean. Months later, no mildew. So some things when you switch is actually much better for cleanliness and all that. I have one last thing to show you. It is, I don't know if you can figure this out. I reuse a lot of things, and these are chopsticks. And, I mark the top just in case I get confused. And anybody have any idea what I use it for? Paper bag, which I also reuse, especially this. Does anybody have dogs? That's what I do. On the side of my bucket, and there is a cover over it. Next, I want to talk about what Replace Plastic does. And a lot of it is thanks to Monty over there from Gita Foods. They're down the street on Main Street, and they've been very patient while we work with them on this pilot program. And we have 3 alternatives to plastic bags. Boxes, which the store provides. Paper bags, we think that we can reuse the single-use paper bags. And then the last thing is we have cotton bags that we get from the supplier and we sell it to the store with the idea that the store is going to get a 25 cents bag deposit fee from the customer. And then when they bring it back, they would get the 25 cents back. As of last month, Gita Foods went from 100% plastic bags to about 13%. 50% of the people are using boxes. We were providing paper bags at the time, and then 20-some% were using paper bags. And 10% of people use no bags. Sometimes with just 1 or 2 items, you don't need a bag. And so I think we have a real success story here and hoping to build on this. Before we get to the Q&A, I want to thank all the Replace Plastic board members for playing an active role in not just in this event, but also in making our mission possible. Lauren Rudnicki, there. Jonathan Lavin. Yep. He's in the room. We saw earlier. Valencia Sundell, who should be online. And Craig Whitty, back there. He would be the one to help you with the Q&A.
Yes.
Yeah, the 413 billion annual cost. Yeah, so the question for the folks on Zoom is about the overwhelming amount of plastic that's used in the hospital and what the heck is the deal, right? I mean, that's sort of the crux of it. There are a few reasons. I think the main is the risk of infection. And so there's this concern that reusing things potentially poses risks of transmitting infections to other folks. There's also the ease of use and then the risk of breaking. So think about back in the day, glass bottles of blood falling on the floor. That doesn't, the risk of losing that nowadays is significantly less as a result. Some of the components of plastic also have like antimicrobial properties like parabens. And there's been some interesting studies in which they tried to get rid of parabens in this St. Jude's hospital and actually saw an increase in bloodstream infections. So it's not all bad necessarily. That said, when you look at like a baby in the NICU and all the plastics that they're hooked up to, modern neonatal intensive care medicine is amazing and has saved countless lives. The question is there a better way to do it that doesn't sort of pose those same risks? So there are movements. Healthcare Without Harm is one organization that's really focused on trying to reduce plastic and other aspects of environmental degradation that are induced by the healthcare system. But it's a fair question, and I think it's really important. And I think we just need to keep asking it because there are better ways, there are better alternatives. We just have to push for it. But the motivation is one of convenience and safety.
I think we were all stunned by the graph that showed the rise of diabetes in conjunction with the rise of plastics. Could you talk about the rise in obesity, which is kind of follows that same curve?
Yeah. It does 100%. It lags a little bit behind it. But Paula Bailey Hamilton wrote a paper in 2001, 2002 that basically showed exactly that same thing. And we see this rise with other disorders as well. So this is not something that's just unique to diabetes. But certainly there's evidence that these chemicals are also linked to obesity as well. We've done studies to show that certain chemicals that we expose mice to make them fat. Independent of anything else, it causes fat cells to develop. And that's a big part, I think, of what we're seeing and directly related to the diabetes as well. So 100%. And now we're looking at obesity prevalence in the United States that's pushing 70%. When you take into account people who are overweight and obese, the prevalence is like pushing 70%. So we're talking about diseases of immense public health significance. And they're linked to fatty liver disease too, which we're working on a paper right now that we think has a prevalence of somewhere around 60% as well in the US population. So these are common exposures now associated with common diseases that are expensive and cause significant morbidity and mortality.
So I would add to that, there are other diseases as well, as Rob has been talking about. And, there's all this talk about rising infertility. So I started the first IVF program in the entire Midwest at Michael Reese Hospital back in the day. So I know that area of medicine very, very well. And I run an andrology lab, which is male reproduction. And there is just this increase in couples who are infertile. All right. And people say, oh, that's because they're delaying childbearing. But it's not just that. If we do the studies that Rob talked about in the cell, in the animals, in human studies, etc., it's very clear that these chemicals are adversely influencing sperm numbers, oocyte egg quality, and all other aspects, hormone levels, etc., that contribute to this increase in infertility. You don't hear about it very much. Pat Hunt and Shauna Swan just had that article in the Wall Street Journal where they address this issue once again. It's the rising levels of these chemicals. Plastics contain all these chemicals. And Ivy, I hats off to you for getting it out in your personal space, in your personal life. And we all have to take those steps forward. But we have to get it out of the biosphere that we're living within. I worked on bisphenol A for a very long time in the context of prostate cancer, but I really got involved in what it was doing in other diseases as well. So I know that area very, very well. I was very involved in it, still am. Studies were done where they would try and just totally get rid of any contact with plastic and whatnot, and see if you could reduce your circulating levels of bisphenol A. BPA goes in your body and out of your body within a day. Okay, so we thought, it was thought that if you could just get plastics completely out of your life for a month and then come in and we'd measure it again. And you could never get it below 50% of what you started with. There was always, and we were like, where is it all coming from? They didn't touch plastics for the past month, and we know it clears out within 24 hours. Well, we've got all those microplastics in our body, and they're sitting there and they're slowly breaking down. So plastics eventually break down into little tiny particles of plastic, and they're in the water, they're in the food, etc. And when you drink the water that contains microplastics, those microplastics get into your body, they go through the bloodstream, they get out of the vessels, and they just implant and set, you were talking about it in the testes. There are no testes without, I just laugh at that because I'm in andrology, but they're everywhere. I see these sections of placenta where there's just all these dots of microplastics in the placenta. So what are those microplastics doing when they're embedded in your tissue, in your carotid plaques, etc.? They're breaking down further into the individual chemicals, and they're keeping your BPA levels high. So you never can get rid of it because you've got microplastics in your body that are breaking that down. And it's not just BPA, it's the phthalates, all those tubes in the babies. It freaks me out, are all phthalates, et cetera, et cetera, et cetera. And plastics aren't just endocrine disrupting chemicals. A lot of other chemicals that are frankly toxic, and they really influence cancer risk and driving cancer to more aggressive diseases. And that's another area I work in. And so these are bad. They're in us. We got to get rid of this sea of plastics that surround us, break down into small, they get into the watershed. You turn on your tap and drink it. You think it's all cool, but it's got microplastics in it.
Same companies that are causing climate change responsible.
Thank you. Thank you for saying that, because plastics ultimately come from petroleum.
Yep.
Yes.
So what's the state of our ability to identify presence of plastics?
Yeah, that's a really good question. So all of these studies looking at microplastics in tissues have been examined outside of the body. So for as far as I know right now, there's no means of sort of getting those assessments because of sort of the chemical properties of those chemicals and their ability to kind of, get stimulated with light or those other tricks that we use to try to visualize things. So right now what we're left with is samples that have been taken outside of the body and that's the best. And then we can measure, what the levels of the individual chemicals are in blood or urine or those types of things, which doesn't get at the microplastic question. So that's an area that will be interesting to see whether there's going to be some science. Probably need some physics done on that to be able to figure out how to actually measure those things. But right. Yeah. We just don't have the technology just yet, but it'll be interesting to see. If we can do it live, it'd be great. Because if we do it live, then you can also see if your intervention can reduce those or whether they're stuck there.
Or whether you have high levels or low levels.
Yeah.
I'm curious, and as I'm doing this, I'm finding more and more, I'm hearing more and more about silos, for instance, political system. What kind of silos are in the medical system?
Total.
That
urology and endocrinology are two different silos.
And yet, most doctors know nothing. I mean, and we can say the same thing in terms of nutrition as well. And I think those two are linked, as you're clearly talking about, say, with the in regard to diabetes.
No, this is 100% true. I think, we're not doing a very good job of talking to each other to get this stuff sorted out. And I think one thing that's interesting about the environmental health field is that, and maybe it's the nature of the people who do this work, some of that is broken down. how we break into the medical field becomes immensely complicated, because what you probably don't appreciate is, while it's data driven, it is very traditional in its approaches, and as such, like, is often closed off to new knowledge that doesn't comport with how we normally do studies, right? But my hope is, and what we see is, that the med students, the next generation, is way better at this than we are. And part of that is climate change. And I think this combination of climate change and its existential threat, coupled with the threats of plastics and other environmental degradation, is creating, I think, an ecosystem of opportunity in which we can start having those conversations to break down those walls. We need to sort of break through some of those traditional barriers, and I think we just need more physicians engaged. And honestly, what gets physicians engaged is patients who are engaged. So if you're going to your doctor and you're asking these questions, I think that starts to move things. Like, it doesn't move medical education right away. It's a slow process, but we need to start asking these questions and pushing physicians then to push their, professional organizations to start addressing these kind of things. So unfortunately, you'd love the experts to drive change from the top, but it really is a desire for knowledge from the bottom that is more likely to affect change, in my opinion.
And also because it's like, we're not looking at the body as a whole, nor are we looking at the earth as a whole.
True.
And those two are directly connected.
Oh, we did this amazing symposium that's available online on neonicotinoid pesticides, these new pesticides, and we took this One Health perspective during that symposium. And we had people talk about water, we had people talk about songbirds, and we had people talk about experimental evidence, and we had people talk about human health. So this concept of One Health, sort of bringing all of these together, is sort of the intellectual framework. I think that would be really helpful for addressing all of these issues, because you're right, it's not just about us, but it's also about crops and these PFASs we're spraying on food. It's about wildlife health and biodiversity and ecosystems in general. So your point is very well taken, and I think we need to do a better job of that.
Well, I have a concern about the first slide. Mentioned BFA as
Yep.
The fluoroalkyls. What would you invent it after beginning of diabetes? So I'm a little concerned that you're getting wound up with being fully presenting the effect of microplastics.
It's a good point. And so the first thing I would definitely acknowledge is that graph is a correlation. The other thing I would say, though, is that those chemicals have evolved over time, but the chemicals that are associated with diabetes are diverse. So the bisphenols, the phthalates, and the perfluoroalkyl substances are one small subset of chemicals that have been linked to diabetes. Some of the chemicals that have also been linked to diabetes include chemicals like DDT that were developed in the late 1930s and then spread in the environment, or PCBs that were used in the 30s, 40s, and 50s before getting banned in the 70s. So when we look at those associations, the bisphenol plastic-associated chemicals are one subset of a larger group of diabetogenic chemicals that are considered. But the point is right. And the other point is that it's all of these other things also. It's increasing sedentary life. It's increasing our jobs are, sitting at desks. They're not on assembly lines, and that probably matters. So I think it's the aging of the population. I would say it's an all of the above type of thing. And so while we think about, the point today was to talk about plastics and the chemicals, I think it's multiple things. But your point is well taken.
In terms of human body, we're talking about what's ingested, right?
No, it can be breathed. You can breathe it in. It goes through your skin.
Yeah. So personal care products matter a lot. So we see that there.
Which I shouldn't be doing.
Yeah, hair care products, those types of things as well. Yeah.
My one vice. Scott.
Yeah. All different routes.
Compostable plastics are very deceptive. So people always say, okay, what are alternatives to plastics? Really, it's about reuse. we've already been there. We've all grew up using glass, metal, and ceramics. And actually, even in the medical field, I mean, didn't there used to be tools would be sterilized?
Oh, yeah.
They still are, of course.
They still are. I mean, because I know going to the emergency room to have stitches and
The whole kit gets thrown out? Yeah.
So it's no longer sterilized. Maybe it is, you know, in
In the OR, they are. Yeah,
Yeah.
they're too expensive to throw out.
So we do know how reuse, because we grew up that way. We've been brainwashed that convenience.
The question is that how can we get the medical community to educate legislators on all of these studies that you have spoken about today?
Yeah. Yeah, it's a great point. And I think the frustration of inaction again is like shared by all of us who like do this work. I think again, this comes down to really kind of speaking to your own physicians. I think it also speaks to the value of our environmental health center and our capacity to kind of provide expertise. So one thing, you know, that you could potentially do individually is reaching out to your own legislators and say, hey, this is coming up. This is a big deal. If you want to know about the health effects of these things, contact CACHE. Contact our environmental health center and ask for expertise to be weighed in for, and we're happy to provide that, right? I'm volunteering, Gail. But we have that expertise and we need to figure out how to have that community.
Yeah.
And when voters push their representatives, our hope is that they'll reach out to us more. So when we did the NeoNICS symposium, we actually invited state reps, state senators, and then US reps to that event also. And I think maybe part of the deal as an environmental health center is we need to do a better job of having events that sort of span the spectrum, because certainly we've got to stop talking to ourselves, right? And I think what's interesting, we had a speaker last week who was amazing, who's at Harvard, and we were having this conversation at dinner afterward, and it's just like, as scientists, we're tired of doing these studies when we know these things are bad and just keep showing that things are bad too. Right. And so I think there is this shift that's happening in the field a little bit where we're really trying to take knowledge into action. And so part of our deal is to try to figure out how we can be better advocates. And these are maybe good opportunities to figure out ways to collaborate where we can basically say, hey, this is the data. And this has been the data for a decade. So get your act together. Let's do something about it.
So are you asking for people to intervene and testify? Is that it? So, right. And so I testified actually for the city of Chicago for getting rid of BPA products in, was it children's things, just children's things, or was banning BPA in products in baby bottles in the city of Chicago. So I did that like in 2009, and Chicago actually led the way. It was Alderman Burke. He was fabulous. He led the way in pushing that through. We were the first city in the nation to do that. That was really incredible. But it took getting people like me in front of the city council because they had a representative from the American Chemical Council at the city of Chicago, and testifying how it wasn't a problem. And it just goes through the body really fast. It's nothing to look at here, and you don't need to ban anything. And then they asked me to testify. And then somebody asked me what ward I was from. I said, I'm from the 43rd ward. And he asked the guy from the Chemical Council where he was from. He was from Virginia. So they all voted for somebody from the city of Chicago. That's the way our city works. But you need experts there willing to step up and do it. And there are. And we get asked if there's expertise. People call our office. I can give you a card. And then we search amongst our members who might be available to do that. And so, yeah, a lot of people are willing and able to go out and do those things. And when you're talking, everybody's talking about PFASs. Another word that you see in the paper all the time is forever chemicals. And so that's what we're talking about. And they're called forever chemicals because they don't break down. And so if they're in you, yeah. BPA clears, PFASs don't.
Probably did an unbelievable study of what happens. Recyclable.
Yeah, absolutely. And it's insane. And less than 5% of the plastics that we put in our little bins get recycled.
It's all performative, yeah. It's meant to make us feel better about buying and using.
And they knew that all along. The people in the plastics industry knew that all along, that it wasn't recyclable.
We've been trying to get a hearing in front of both the environmental committee and the health committee.
Oh, good luck. I've been trying to get on the phone with them the past 2 years. So how have you done?
Nothing.
Yeah, right.
Okay, so that's interesting. I think we can all do our part in terms of making choices in how we shop.
Absolutely.
And what we use. But ultimately, it comes down to legislation. These kinds of hearings, I think, are really important. My other question to you, you mentioned how much it costs to treat these bodies that are being contaminated and affected by diseases. And I have to wonder, when are we going to recognize that it would be cheaper to stop the production of plastic than it is to keep inventing things to combat diabetes, obesity, like with this new drug? This is going to put off school to change things because, okay, we have a
Yeah, Ozempic is the solution to everything. Yeah, and people are starting to do those analyses. So Leo Trisande at NYU has done a lot showing like what the economic cost of some
There
of
have
these
been big
chemicals are.
economic analyses of getting these out.
Yeah.
And how it would reduce healthcare costs. Big economic analysis have been done on that.
We're starting to get those data.
Yeah.
And is it doctors doing that or
Economists are involved. Yeah.
Yeah.
Europe is way ahead of us. And so on all of these issues. And so a lot of this data is available in European studies.
Yeah. We can do better there. There needs to be more. And you're right. Like, I mean, the idea is like, we don't factor in the cost of these when we're thinking about like what the cost benefit analysis is, for sure. So, I mean, if we want to affect change, if the currency of the realm is cost, then we need to be having those economic discussions. It's frustrating because from a justice standpoint, there should be reason enough to do something, but these data help too. There's no doubt.
It's all about the money.
it is all about, and that's where I think the US differs.
Yeah.
Do either of you do anything to protect yourselves in addition to what Ivy reviewed?
Ivy's amazing. Like this was just a phenomenal, and I got a bunch of ideas to take with me. I may take this with. I don't know. Yeah, I think some of these things. She's I think demonstrated a lot of the good things. Like we're trying to remove plastics from the kitchen is a big deal. I mean, you think about like directly exposing yourself.
Yeah.
So the move to Gail was just saying that she's converted to all glass containers, which we've done, and then trying to remove plastic utensils from cooking, moving to wood, steel, metal, those types of things like is really key as well. And then I think being a smart consumer and trying to choose glass, the glass peanut butter stuff is a great example of that. It's a little bit harder to find, but making those things
But it's there.
but it's there. You just got to choose them.
It would increase, right?
No, that's right. And maybe that's part of the deal too, is even if it's a little bit more expensive, we can create economies of scale by all committing to do that. And ultimately they'll increase production and reduce the cost. Like we can do demand side changes here, I think that can.
Yeah. I don't wear synthetic clothes.
I think we need to wrap it up. We're way over time.
That was fun. Thank you, Ivy. Thanks, everybody.
I want to add that our next event for Replace Plastic is April 8th, 2025 at the Skokie Library. Come back to see us. Thank you.